I think we've got our recording started now. So, hello everybody and welcome to our Moving OT session for today. Today we're delighted to be joined by Jamie Squires, an occupational therapist and lead for our long COVID service provision at Sport for Confidence. So Jamie has over 10 years experience in exercise instruction. And in addition to his qualification as an occupational therapist, he has also worked as a wellness coach supporting people with neurological conditions to access physical activity. So Jamie will be presenting today on managing fatigue and sharing his learning from his work with the long COVID service, which is a partnership between Sport for Confidence and, you'll have to correct me if I get this wrong, Jamie, East Suffolk and North Essex NHS Foundation Trust. Is that correct? Yeah. Fabulous. And take it away, Jamie. Thank you for joining us.
All right. Good afternoon, everyone. I will start by sharing my screen here. Okay. Can we see that? Is that all right?
Yeah, can see that.
Lovely. Brilliant. All right. So welcome. So today we're going to be covering about fatigue management. So as Lisa already said, if you have any questions as we go through, do pop them in the chat because I'm going to try to allow plenty of time at the end of the session to answer as many questions as possible. But the next 35 to 40 minutes, I'm going to talk through about how I have learnt in terms of managing fatigue, particularly with long COVID, but fatigue in many different aspects and many different health conditions that we may see, and how we may approach physical activity as part of that, and the challenges and ways to potentially overcome those as well. So, and how to help manage participants engaging in physical activity or any patients that we're working with whilst doing so. So, first of all, to understand a little bit about how fatigue may impact a little bit to an individual. The first thing that we generally try to cover is that fatigue and tiredness are not the same. So often in my groups, I will ask people to describe fatigue before I explain that fatigue and tiredness are not the same, because a lot of people may describe their fatigue as tiredness or explain that they are tired quite often, which is perfectly valid because tiredness is certainly a symptom of fatigue. And if someone is fatigued, it's quite likely that they are experiencing some level of tiredness there as well. However, the impact of fatigue tends to be much more profound and overwhelming and severe in that it's quite unpredictable, can be much more debilitating, and it can be a lot more variable than regular tiredness. Another very important distinction is that it's not necessarily alleviated by resting or sleep. Rest and sleep can definitely help in terms of supporting someone's recovery if they're experiencing some form of fatigue or difficulty with managing certain health conditions. However, it's not an answer to fatigue. Another important distinction is that it's often not proportional to effort exerted, i.e. if someone did a small amount of physical activity, they may feel far more fatigued than they would expect, usually if they're experiencing some kind of external variable, which is causing them to have more difficulty with that there. It can also be much more disruptive in terms of things like motivation, can have an extension onto cognition, often described as brain fog, some kind of difficulties with communication, concentration, attention, and all those kind of things as well. So it is very common following illness or infection. It's also very common with many different health conditions that we work with, from cancers to neurological conditions to long COVID in the space that I work as, like fatigue and ME as well. Obviously, a very common symptom there as well. So it's often caused by extension of those conditions by a difficulty with systemic recovery and managing stresses. And they can come in many different forms, and a challenge with our body managing, but then also recovering from those stresses as well. Okay. So symptoms of fatigue. So anyone can experience fatigue, as it's quite common following illness, infection, or health conditions, but generally symptoms of fatigue are going to be physical weakness. So that might be weakness in the limbs. It might be a low energy, so that tiredness that we're thinking about, feeling like there's almost no energy there for things like physical activity or even cognitive activity. It generally tends to be fairly constant and ever present in that someone's experiencing fatigue. there's rarely respite from that. It could result in a lack of motivation, i.e. a reduced desire to do meaningful activities. Difficulty with cognition, so concentration, particularly with things like word finding difficulties, engaging in conversation, learning new skills, those kind of things. That cognitive side of things is often one of the more impactful symptoms that someone with significant fatigue will experience. Difficulty starting, i.e. initiating or even completing tasks due to those physical or cognitive symptoms, but also that motivation as well. There may be some other things as well, sort of aching or sore muscles, joint pain and muscle pain are very common as well, or drowsiness, falling asleep in the afternoon is pretty common and typical. There are some other symptoms as well, which we'll discuss as we go forward, but generally these are going to be some of the larger, more impactful ones as well, that physical and cognitive change in ability. So when someone's experiencing fatigue, they're not likely to want to engage in physical activity. However, there is also quite a significant risk of someone with fatigue, any of the symptoms of fatigue or any of the conditions that may cause fatigue, that they may avoid exercise, or if they do exercise, they may experience some post-exertional malaise or post-exertional symptom exacerbation. So because fatigue is almost always caused by challenges with dealing with stresses. So, for example, physical activity, cognitive activity, emotional stress, stress at work or family stress, or even sensory challenges. Adding on to those stresses and sort of exceeding our tolerance to manage those stresses can cause an exacerbation of existing symptoms. Sometimes you may hear that referred to as boom and bust. So with boom and bust, it's possible that you might experience variability in symptoms in terms of an increase in symptoms after physical activity before sort of returning to baseline, perhaps overreaching again, that sort of boom effect, and then that worsening of symptoms again, which sort of takes you beneath that baseline. So with that difficulty recovering from stresses, things like overworking, too much exercise, emotional or psychological challenges can all contribute to this to work together, or any significant instance of one of those may cause this post-exertional malaise, which is very common. So it would be the worsening of symptoms essentially. So you know that someone's experiencing post-exertional malaise if they've done something that is not typical of their usual routine within their baseline, which can cause up to about 48 hours afterwards. So anywhere sort of the day after to 48 hours after, they may experience an exacerbation of symptoms, which can last days or in some cases even weeks, which is obviously very impactful on people's livelihood. However, we can all recognize that physical activity, exercise, sort of domestic activities, going for walks outside, are extremely supportive of our health and well-being in many other ways. So there exists a space for us as clinicians, or when we're working with people who are experiencing fatigue, to help them find a level of activity that's going to get the benefit of physical activity that we all engage in physical activity for, whether that be physical ability, i.e. muscle strength and tone, cardiovascular ability, or the sort of psychological effects of physical activity in terms of boosting mood, a boost in sort of self-perception and confidence. All of the positive effects of exercise would still apply to someone who is experiencing fatigue, but we need to be quite mindful of how we approach that in terms of not entering this boom and bust kind of cycle that's so easy to break into. So how do we mitigate post-exertional malaise and engage in physical activity or other activities that may accumulate fatigue, but in a way that doesn't exceed tolerance? So one of the best ways that we can do this is to monitor symptoms to ensure that they are predictable and stable. So if someone is experiencing boom and bust, where their symptoms are very variable, so on Monday they felt great, they did a bit too much. On Tuesday they didn't feel as good. Wednesday they felt even worse, for example. That suggests that the level of activity that they're doing is probably beyond their tolerance. So, and that presents the challenge of how do we modify someone's activities to bring it within their tolerance so they don't experience this boom and bust cycle, but can also not eliminate those important activities from their routine. What we don't want to encourage people to do is almost take away their ability to thrive and engage in activities that are important to them, especially if there's a way that we try, even emotional stress, sensory, social activity, or cognitive activities, things like work or hobbies, whatever it might be. Reading, watching TV could even count as a cognitive activity. So they may notice that their energy levels drop, and then they may experience other signs of post-exertional malaise. So as we said, changes in sort of alertness, tiredness, cognitive changes. Disruptions to sleep is another good signal that we might have there. People unexplained disruption to sleep pattern. Changes in appetite, either significant increases or decreases. Sensitivity to temperature, pain or more, could indicate that we're sort of entering an area where post-exertional malaise might be a possibility for someone. So recognizing where these triggers may happen is also quite important. So is there anything that changes or gives you a signal that explains that you're overreaching, so we can stop overreaching perhaps before we accumulate too much fatigue? So that can also be some more unusual things. Maybe tinnitus is quite a common one that I see. Someone might start experiencing tinnitus before they become fatigued, but it's sort of like that signal, that trigger where they're like, actually, if I'm experiencing that, I know that I need to stop and rest. Okay. So ultimately, what we want to do is limit stresses, so physical stress, cognitive stress, emotional stress, as much as possible to manage the accumulation of fatigue and ensure that enough recovery time is taken before an activity, during an activity, or even after activity to make sure that we're avoiding post-exertional malaise. So there's a few ways that we can help someone do this. So first of all, we can enable their recovery. So there's a lot of things that we can do that are kind of external to symptoms that will likely have an improvement in terms of the presentation, but also management of those symptoms. So things like staying hydrated, having a good fluid intake will help with that quite a lot. Getting enough sleep, supporting our recovery with good, high quality and good volumes of sleep. Exercising, ideally outside where possible, can support our recovery quite nicely. Feeding our body the nutrients that it needs as well, so a healthy, balancing diet, rich in different foods. Maintaining a healthy body weight can definitely help there as well. Engaging in mindfulness to really trigger our parasympathetic nervous system to sort of slow us down, calm us down, and engage in what we call proper rest, not just doing very little, but still being stressed out. Maybe engaging in a level of rest that's going to be really low heart rate, really chill, can definitely help there as well. Taking regular breaks, breaking tasks up as best as possible to engage in them a little as often. And then doing things I enjoy. So something I find myself doing quite a lot is prioritize the things that you enjoy and support your health and well-being rather than reducing those, because they can really support your sort of emotional wellness and help you manage stresses. So reducing alcohol and smoking, if you do drink or smoke, can definitely help there as well. Can improve sleep, can improve neurological function, all those kind of things. Okay, so how to tell if someone's overreaching? So generally, if someone describes themselves as pushing through an activity, that is likely a good signal that they're doing too much. A lot of people will describe, especially if they come up against a sort of challenge, a health condition, that they will push through their symptoms, i.e. they'll just keep on forcing themselves to do what they would normally do. And then that's what really introduces that boom and bust kind of cycle. So usually pushing through is generally a good thing. To meet things head on can help people work through a lot of things. And that's a good personality trait for dealing with a lot of challenges. Whereas in the instance of fatigue, that's going to add to that sort of dysregulated cycle that they're in, where they're actually sort of taking one step forward and then two steps backwards, because by pushing themselves beyond their tolerance for that stress is actually almost causing more harm than good. So exacerbate their fatigue and actually make it more difficult, or at least longer, to recover from the challenges they're experiencing. Again, as I said, variety symptoms try to reach a flat baseline. So someone can engage in a similar level amount of activity each day, even if it's a lower level, to avoid that cycle of good days followed by bad days, which generally indicates we're enabling an environment where recovery is much more likely to happen and improvement of symptoms is much more likely to happen. And also, not fast is generally better than having a good day followed by a bad day, where lots of things have to move or be cancelled because you're not up to them. As most likely they're pushing themselves too hard and accumulating far too much stress or fatigue there. So there's a few ways we can advise someone, and how do we reduce the amount of fatigue we accumulate with activities? So the common sort of way of describing this is planning, pacing, and prioritizing. But I'm going to build upon that a little bit about what's the best way to plan, what's the best way to pace, and how do we prioritize those kind of things to enable us to do more, but mitigate fatigue accumulation as best as possible. So,
just so that you're aware, Jamie,
to reduce fatigue.
Sorry,
yes,
Jamie, your signal is dropping out a little bit, just so that you're aware. We can see most of the slide. I don't know whether this is the same for everybody, but there is some disruption to the signal a little bit. That one seems to be fine.
Okay.
Yeah.
Yeah. Okay. No worries. Have you been able to hear everything?
Most of it, I would say. Sometimes it does cut out a little bit.
Okay. Let me know if it gets any worse or anything, or if you can't hear me. No, I don't know what I can do about it, but I'll do my best. All right.
Thank you.
Okay. Different ways that we can modify an activity. So a bit more depth into pacing and how we can pace to make that a little bit better. So there are 3 ways that we can modify any activity to change how fatiguing they are. So the first, which of there, is frequency. So essentially how often you do an activity. The second of which, how long we may spend on an activity in a given block of time. And the third of which is intensity, i.e. how challenging or difficult that activity is in the given moment. So what we want to do to mitigate fatigue is, these are almost in inverse order of least fatiguing to most, in that frequency is the least fatiguing way to engage in an activity. Duration is slightly more fatiguing, and then intensity is even more fatiguing than that. Okay. So as we can see at the bottom there, frequency is what we want to prioritize. So doing something little and often is the least fatiguing way. So we want to try to engage in an activity for a short amount of time and then follow that up with rest. This challenges our energy systems far less than if we were to just continue to push ourselves to do something for a long period of time. So when we're looking at mitigating fatigue, it may be that we want to split activities into small bite-sized chunks, i.e. that little and often. So an example of this may be if someone was going for a daily walk for an hour at a time, and then the following day they were feeling quite fatigued after that hour of walking, it would likely be far more beneficial if they split that up into perhaps 20-minute blocks, i.e. one 20-minute walk in the morning, one at lunchtime, and then one in the afternoon. This way that they can engage in the same level of activity, but spread out in a way that accumulates far less fatigue, because it challenges our aerobic energy system much less, and much easier for our body to tolerate and then recover from by resting a little bit and recouping our energy in between each time we do that activity, but still have the same net amount of activity there. The next way we would look at perhaps increasing or modifying activity is to reduce the intensity and increase how long you engage in that activity for, i.e. again, if I was doing something that's quite intense, let's say I was running. So I'm running to get some cardiovascular activity in, generally quite supportive of my health, but every time I go for a run, I'm extremely fatigued afterwards. Could I run for a little bit less time, or stop running entirely, but maybe walk for a little bit longer? So let's say at the moment I'm sort of doing 15-minute runs every day, but I'm always fatigued. If I was to go up to 30 or even 40 minutes of walking, which is much less intense, but a much longer duration, I'm likely to get equal benefits in terms of cardiovascular health, other effects of physical activity, being outside, those kind of things as well. But again, doing it in a way that doesn't fatigue me. So modifying these 3 variables, reducing our intensity, perhaps looking at increasing our duration, or splitting our activities up to do them little and often, as frequently as we can, but for shorter periods of time, is going to help mitigate and manage our fatigue on a sort of a whole scale. This could be things like domestic activities as well. So, for example, I can reduce the intensity of meal preparation, for example, by can I sit down during meal preparation? Or maybe I could split meal preparation into two sort of sessions of meal prep. In the morning, I chop the vegetables, prepare things, get them ready to go, and then in the evening, I can just assemble that meal. So again, I've split it up into two different activities. An actual real world example that a participant gave me is instead of thinking they need to empty and then fill the dishwasher in one go, they almost viewed that as two separate tasks. They could empty it in one instance, then come back a few hours later and refill it again, for example. Again, sort of splitting that up into that little and often making it a little bit easier for themselves. Okay. This also gives us a way to perhaps advance someone in that once they are in a place where they're managing their baseline really well and they are tolerating the amount of activity they're doing, they may want to introduce more into their routine, i.e., they've facilitated improvements in their symptoms or their health and well-being. So some doors have opened in terms of being able to access more of their important activities. So how do we introduce something new or increase the amount of what we're doing? We might look at this. Hey, can we do that a little bit more often? Instead of going for a walk once a week, let's try twice a week. Or can we turn a 20-minute walk into a 30-minute walk, for example, to slowly increase the amount of activity, test where their tolerance is at this moment, see if they can still tolerate that. And if they can continue that until their tolerance may increase again. And they have more headroom in terms of their energy to introduce perhaps new or even sort of more activities into their routine to return to those activities which are ultimately going to be supportive of their holistic health and well-being. Okay, so in that conversation, you may speak to someone about where their priorities land. So obviously we want to be prioritizing things sort of in this order. Priority number one is going to be things that they need to do on a day. Priority number two is going to be things that they want to do on that day, so would like to do if there's space in their diary. And then finally, priority threes, which are what can be put off, i.e., I can do it another day, or I can do it next week, or actually, what do I not need to do entirely, in that I can ask someone else to do it for me, or you know what, if it doesn't get done, it's not the end of the world. So obviously, when we're sort of completing sort of a plan with someone or talking through how to manage a diary, put your need to do's in first, and then work out where to shuffle them around to split them up into that little and often, where we might be alternating between activity, rest, so on and so forth. And then exploring where within that do my want to do's fit into that space. I might have an hour or two gap in the afternoon where I've got a bit of rest before and after, and I can add in my want to do. That's where exercise may fit for someone, as long as it's appropriate for their routine. And then actually, what can I ask someone else to do for me? So what have I planned to do that I actually probably don't need to do that I can ask a partner, I can ask a friend. So with prioritizing, I often find that people perhaps misprioritize, for want of a better way to explain it. Some people will put priority twos or even priority threes out of priority one because it's something that's a promise they've made or something that they feel like they should do, or it's kind of part of their roles or responsibilities. So, for example, they promised a friend that they would help them, you know, move house or something like that. But it may be on that day they've got really, really low energy or they're feeling fatigued. So they put that as a need to do. So I'm going to go there, I'm definitely going to do it. It's a non-negotiable. But actually, that could be a want to do. Promises to others, maybe things that I'm really sorry, but actually I don't have the energy for that day. I'm going to have to cancel. That's okay in some instances. Or approaching those by saying, yes, but instead of doing that right now, I will do it, you know, tomorrow when I've got an hour in the afternoon when it might be more appropriate. So I'd encourage someone to think about where am I putting things at priority one, where they could actually be priority twos. The next thing is that a lot of people put things that should be a priority one lower on their priority, i.e., big one being their health and well-being. Now, I'd love to have a rest after this activity, but you know, I haven't got the time for it. If people flip their mindset in terms of thinking, actually, I need to rest after work, so then I've got the energy to actually spend some time with my children or prepare a meal, that's a better mindset change in terms of it turns your health and well-being into something that actually supports you and enables you, as opposed to something that kind of gets in the way. So health and well-being should be a priority number one, not a priority number two. And again, sometimes having that discussion with someone to change that mindset can actually be really valuable for them in terms of thinking there probably is spaces where they haven't prioritized themselves and the health and well-being outcomes of those activities because they feel too busy or responsible to others. So I definitely have that discussion and encourage them to do that. Okay, so once we've got our priorities, we can then sort of fill out our planning. What things do we find the most fatiguing? Is it exercise? Is it socialization? How important are those activities? They might be extremely fatiguing, but they also might be really important. How are we going to balance that scale? If socializing is a really huge beneficial thing, definitely reserve energy for it, or make sure that we are engaging in a way that mitigates fatigue accumulation as best as possible, resting before and or after, making sure we can have breaks in quiet spaces, or just maintaining social contact in a sort of less stressful way, maybe online, through phone calls, video calls, rather than in person as often, but seeing where you can fit those important activities in. But try to fill out the diary with the high priority activities, then starting to add in other activity based on how they feel. And then just make sure we're quantifying how much energy those are taking. So activities that do take a lot of energy are not synonymous with activities which are bad, but there's a consideration to make there in terms of if I'm going to make the investment of 40% of my energy for that day to socialize, that's going to have an implication on how much energy I've got for the rest of the day. So I might need to make sure I've got a quiet day before I've got something busy or stressful coming up. So how do we balance the scale across all of our activities, physical, cognitive, social, and emotional, to make sure that we're not booming and busting? And we can use that sort of frequency, duration, and intensity variable to reduce the amount of energy that it needs to be invested for certain activities in many ways. So progressing, always encourage people to not break into a sprint. So we need to learn to swim before we get to the deep end. So taking your time rather than just diving straight in the deep end with no plan of how to manage that. So make sure we're looking ahead as best as possible, knowing that best made plans, often don't work out. But if we do plan, it makes it much easier for someone to manage challenges, or when the unexpected happens, if we had a good, robust plan, we might be able to modify that quite happily. Whereas if we just take things as they come, it's much more likely that we might be booming or busting. Making sure we're establishing a new baseline and tolerance, i.e., if I feel like I've got a bit more headroom and a bit more energy to invest in more activity, making sure that we're still not entering that boom and bust cycle where symptoms are variable or unpredictable. It's a good way to assess whether the increase in progression you're making is actually good. Then increasing very slowly, i.e., allowing time for that person to review how they feel. So every 2 to 3 weeks, if most days are good and predictable, increase by 10 to 20%. So an extra sort of 5 to 10 minutes of activity. If we're not managing well, or if fatigue started to build up over several days. So day one, I did a bit of walking and it was fine. Day two, it was okay still. But day three, I started to feel tired. Maybe we could have had a rest day instead of that third day in a row. Giving that 2 to 3 weeks to try things out and then adjust appropriately is a good plan, because sometimes just doing something once doesn't indicate how we're going to respond to it over the course of doing it several times in a row. So take their time, assess where they're at, make sure that they are managing, and then adjust appropriately. And finally, it's okay to get it wrong. I'll put my hands up and say sometimes I haven't hit the nail on the head first try. Sometimes the only way to find out where someone's baseline is or what their activity tolerance is to try. Once you know where it is, you can adjust as necessary. You can do the best guess possible in the world based on your previous experience or people that you've worked with, or even if it's just purely speculative. But until you do that, you don't 100% empirically know whether that's tolerable or not. And if it's not tolerable, then you adjust. So what I'm trying to say is just try not to be too afraid to sort of put yourself out there, try something with someone, and then review it. Obviously, come in at a low level to make sure as best as possible that we can that we're not overreaching. It's not worthwhile getting someone to do a level of activity which we can almost guarantee is going to do and sort of introduce challenges to them or be way too much for them. But try some things out, see where they're at. They may surprise themselves with how much they can tolerate. Because there is a certain point where there needs to be that affirming effect of trying something you think might go wrong, but then it doesn't, because that tells us that we're in a good position to progress, improve, and introduce more of those meaningful activities that we may have eliminated due to fatigue. But there's definitely a trial and error aspect to that. So we're going to try to hit the nail on the head, but if we miss, we can always try again based on the experience that person has. So the silver lining to overreaching is that we now know what's too much. Let's review and try again. So that is actually pretty much everything that I go through. I think I've covered everything that we speak about in presentation. So if I stop sharing, some time for some questions, all right?
Fabulous. Thank you so much, Jamie. That was really informative, and I've written down loads of notes from that. I've got lots of questions. I know we've got some in the chat as well, though, so I'm not going to hog all of the time on my questions. Sam or Liz, do we have any questions from the chat that we can give to Jamie?
Yeah, so Lucy has asked Jamie, so I'm currently on an acute stroke ward. Fatigue can be something our patients struggle with. They have other stroke symptoms to recover from. What would be the first step of fatigue you suggest as a goal or a focus? And these patients would normally have OT and physio daily.
Yeah, so I think that's probably a discussion that you'd have with that person, knowing that obviously stroke can be extremely variable in the impact that it can have on individuals. I think it's about assessing, first of all, what kind of things would they want to do? And then I guess that gives you the baseline of actually, if that person is trying to achieve a certain level of activity, then you would start to look into that activity in terms of the variables. Let's say that person wants to be up on their feet a little bit more. You know, being up on your feet as someone who's recently experienced a stroke can be extremely fatiguing. Bearing that weight can be far more challenging for an individual who's recently experienced a stroke. So it may be that that is a very intense activity. So you might look at that variable again and think, right, if we're going to engage in something that for them is relatively intense and is likely to introduce some fatigue, then we're going to see how we can reduce the duration of that, for example. So I wouldn't have them up on their feet for 20 minutes, 40 minutes. I might only do it for a couple of minutes at a time. It only takes a very small amount of activity to promote some kind of positive change in most people. So just by being up a little bit, again, there is a fatigue implication. Anything that we do, you know, that's exercise, social activity, there is going to be some kind of investment of energy and a potential implication that that's going to cause some fatigue. But there are ways we can mitigate that. So if something's intense, just do it for a short amount of time. Right? So I think it's relative to how that person's experiencing it. But again, manipulating those three variables, intensity, duration, and frequency, to make sure that it's as manageable for that person as possible.
Brilliant. Thank you, Jamie. I'm just wondering if there are other questions. I've seen a few have been dropped into the chat just now. Sam, do you want to go for those as well?
Yeah, sure. There was also a question earlier about just sharing of slides, Jamie. Would that be? I know that the video will be shared on YouTube, of course, but
yeah. So Lisa, are you planning to share the slides that I've sent to you?
Yes, yeah, I'm happy to share those if they're shareable. Yeah, you're happy to them to be shared.
Yeah, they should be.
I'll skip past Lisa's question because you can ask that after Lisa. So Portelli Chantel has written, I work in a long-term care facility, mostly geriatrics. It's common here that once a person is admitted into a nursing facility, they become institutionalized in a way, and in a way lose the energy, drive to do anything for themselves. It's then very difficult to try to introduce any type of activity, even refuse to leave their own room in is difficult at times. Do you have any advice?
Well, that's certainly a challenging one. Yeah, definitely. I think again, it was probably coming down more to that sort of therapeutic use of self in terms of just encouraging them, providing that environment. And I guess somewhat anecdotally, people tend to respond well to the sort of repeated bout effect of you trying to encourage engage with them quite often. So probably not related to my presentation at all, but what I'd say is that even if that person seems like they're not engaging super well and they've said no the last 20 times you've even approached them, keep on going, because sometimes just a switch might flip in them that it's actually, you know what, you can explain the benefit to them as many times and they probably understand the benefit of what you're trying to get them to do quite well. But I think I would just keep on trying in that instance, and hopefully eventually they'll come around to it. Maybe not in some instances, but I think that's what I'd say.
A really tricky one, that one.
Yeah, that
Isn't
is a
it?
challenging one, definitely.
Yeah. And I wonder, it's all about taking it back to, well, what's important to that person? What would, really not motivate them necessarily, but what drives them to want to engage in occupations? What are their meaningful occupations? It is tricky though, if you've got somebody who's been in a facility for a long time. I can, empathize with that. That's a really tricky one. So thank you for asking that, Chantel. And I think it's a tricky one for us to answer, but I think you've got a few pointers there, hopefully.
I also think the other thing about that perhaps is maybe about the sort of transferable skills that we might look at. So a lot of time, exercise is kind of, exercise for the sake of exercise is hard for people to engage in because sometimes it's not really enjoyable. But sometimes someone might say, "Oh, I really like going out for walks." Well, that by extension is exercise, but they might not view it that way. So something that's fun and enjoyable and that's something that's want to do, the secondary effect of that is an increase in physical activity. Again, that could be an approach. I've almost tricked them into more movement, whatever it might be.
Sometimes it's taking it back to play, isn't it? What is enjoyable for that person. That's a really good point, Jamie.
Find that meaningful activity, right?
Yeah, absolutely.
Cheers, Jamie. Joanne has written, a family member of mine has CFS and a spoon theory, and planning is viral, as you explained, but with the right approach, people will still have the condition. People with this condition can still have a fulfilling life. I think,
yeah, absolutely. Yeah, I echo that sentiment 100%. And it's a case of sometimes it's like, oh, do less and less and less. It's actually, let's find a way that there's a way that we can fit in some of these meaningful things. Absolutely possible for someone with a very long-term condition or even lifelong condition to engage in things that are meaningful to them, as long as we do it the right way.
It's a really good point around spoon theory as well. Do you use that, Jamie? And I don't know whether everybody understands what spoon theory is. I don't know whether you use that with participants and could explain a little bit.
I think it's a good analogy for a lot of people. It helps them put some kind of like a visual aspect to it. So sort of in short, spoon theory is, you'd imagine that at the start of a day, you'd have a certain number of spoons, let's say 10, for example. Every time you invest some energy or do an activity that requires some effort, you spend some of those spoons. So, for example, getting washed and dressed might take 2 spoons. So I might have 8 spoons left for the rest of the day. Travel somewhere might take 3 spoons from me. So then again, I've got another sort of 5 spoons for the rest of the day. Then I had, some really good food and I had a bit of a rest. So I actually gained one of those spoons back. So I've got 6 spoons for the rest of the day, for example. So it's actually a good way of someone to almost sort of quantify their energies a little bit better in terms of how much is an activity going to cost me as an energy investment, and then how much have I got left for the rest of the day. And it's a good way of visualizing it so people are less at risk of overreaching or spending more spoons that they have. But it also does help you sort of understand that actually if I spend 11 spoons, but I've only got 10, that'll only leave me with 9 for the following day. So it sort of, again, visualizes that accumulative effect of over engaging in activity.
It's a really good explanation. Thank you, Jamie. And I think that's really important as well around that kind of spending of energy and replenishing of energy as well, and how we can get that back and how that might cost in future times as well. That's a really good point.
Yeah.
Cheers, Jamie. Georgina's question is that she's a school-based SEN OT. Do you have any checklists to use with students to gain an understanding on their feelings/symptoms and to use the 3 Ps?
Yeah, I don't have anything too specific on that. And I guess in some instances, it might feel a little bit esoteric when we're talking about those sort of 3 Ps and that sort of like modifying of activities and things in some instances. So yeah, it is definitely challenging. I think again with pacing, I think it boils down to little and often. If I can do things just a little bit at a time to sort of take a longer time to achieve something rather than just trying to plow through and sort of finish. I might explain it as sort of like starter finisher. Sometimes if you start an activity, you just want to finish it, but it's okay, sort of changing that mindset to actually let's go do something else or rest for a little bit and then come back to that. I think that helps. In terms of planning, again, it's encouraging that sort of that foresight in terms of I've got something coming up this weekend, so I'm not going to plan in a whole bunch of other stuff in every extra little bit of space I've got. So how can I modify my diary a little bit? And then also in terms of prioritizing, it's like what's most important to a person. Because they have to do it or they really, really want to do it or they should do it, then that kind of goes in first and then everything else kind of second to that. So
I wonder as well if you talked about diaries a little bit, if there's any kind of strategies that you use to kind of plan people's time, or I know Georgina mentioned checklists, but whether the use of diaries or something similar has been helpful with any of your participants.
Yeah, quite a few actually. You get sort of both sides of the coin there, where some people find physical resources really, really helpful. Some people don't so much. But I guess in instances where we have used physical resources, that person's find it again like really useful to have a visual representation of how their diary works. Because what they might see is that my entire morning was red. All I did was loads of energy in the morning, and then the entire afternoon was green because I had no choice but to engage in rest-based activities. But sometimes just having that big block of red and that big block of green in front of them puts it into perspective in terms of I know I'm doing too much here, so maybe I can modify that. And it should almost look like you're sort of going back and forth. You should be going back and forth between something that takes energy, gives energy, takes energy. So that's a kind of good way to visualize it, and it's a good thing to work through with someone. Because if we can see that someone's clustering up loads of activities into one space of time, then we can be like, how do we spread this out so it's a bit more manageable? We're not, completely wiped out for the next day. That might help going through physical resources and diaries with someone.
Yeah, I suppose it's quite individual to the person, isn't it? It's sometimes it might be helpful and sometimes not so much. But yeah, that's really good. Thank you, Jamie.
Cheers, Jamie. One from Liz. What lessons have you learned from working with individuals managing fatigue that have shaped your practice as an OT, and especially working with Sport for Confidence?
Oh, so many. Let's see if I can narrow it down so we'll actually finish at some point today. But I think some of the big ones, particularly in things like long COVID, and the same will be true in any CFS, is first of all, just having someone that you can sit down with in person and have a discussion with who listens to you is a very important thing for a lot of people. That often triggers a little bit of a sort of psychological response where they're like, actually, someone cares. And it's much easier to engage in a sort of treatment or intervention with someone that you feel as though they care about you. So that's a big bit of feedback I get, is being able to interact with a clinician that understands and wants to help and doesn't just sort of turn me away or explain my difficulties by the condition I've got, but also just being able to interact socially and share their experiences with other people. So my services are all run in person, and I almost unanimously get feedback from every person I work with saying that being able to actually just relate to other people is so valuable to them. So that peer support is huge, whether it's from a clinician, whether it's from other people who can sort of relate to their experiences. That's a really, really big one, I think.
Fantastic.
Cheers, Jamie. So we've got one more from Georgina, also looking to support a student with activity modification and reduce intensity to prevent busts that is reported on evenings and weekends. The student's wanting to continue to maintain high level of activity / play with peers and will only access rest breaks during lessons. Concerns of finding the healthy balance with other challenges of having a limited diet and no meals during school day and only wearing a t-shirt for outdoor activity. Do you see the need for interoception work with SEN to support their awareness before finding the right strategies?
Yeah, I think I see there's lots of challenges with finding something that they're going to gel with, essentially. So sometimes if it just doesn't, if they don't want to engage in something, then that's where the challenges come up there. Absolutely. So I think it's a case of finding a way that actually sort of incepts that idea in them to be able to start to engage with it to begin with, before you can start thinking, oh, let's modify your intensity, let's modify your duration, all those kind of things, because they're just not meeting you at the place that you're at with, I want to make these modifications, but there doesn't seem to be space for those. So I think you've got to kind of got to almost go back to square one in terms of how do I actually get this person to engage in a conversation with me where those changes can start happening and I can start influencing those. So definitely another challenging scenario. Yeah.
That's a tricky one, isn't it? I wonder how old that student is and whether it would be possible to engage them in a bit of discussion potentially around. It is difficult if they're not eating very much during the school day. That's not going to help with fatigue. And not dressing maybe appropriately for the weather conditions. But I wonder if it depends on the age of the student how much they can connect those things to the things that they want to do, socializing with peers and things. So yeah, that's a really tricky one again, Georgina. But hopefully there's a few pointers there for you.
And I think as well, there's another thing of actually sometimes rest activities don't have to be doing nothing. Sometimes it can be,
Yeah.
one of the best rest activities that a lot of people do is just, having a chilled evening with some friends over. Because I didn't engage in any physical stress. Maybe I had a beer or two with friends, but the effect that had in terms of triggering my parasympathetic nervous system, my rest or digest response, was really impactful because that environment just signal chill to me. So sometimes actually what can that person engage in that actually calms them down a little bit? It doesn't have to be nothing, because sometimes that's not the answer, but it can be, is there something that they find really therapeutic?
Yeah, and it could be something related to education potentially if it was, for example, fine motor tasks or, people find colouring and stuff very relaxing. It's whatever helps us to replenish those spoons, I suppose, isn't it? So discussing
Absolutely.
that with the parents and the student maybe themselves as well.
Yeah.
I'll go back up to Lisa's question now, just with regarding referrals. So where do referrals come from for the long COVID service? Do participants stay with the service for a length of time, and then you refer them to other services?
Yeah, absolutely. Yeah, that's pretty much it. So all the referrals come from ESNEF, so East Suffolk and North East Essex NHS Foundation Trust, a branch of them called SNELCAS, which is the Suffolk and North Essex Long COVID Assessment Service. All of our referrals come directly from them. So they kind of would have had sort of like a level of intervention already in terms of management, and that we're sort of a step down from that in terms of now that they're in a position where they should have all the knowledge and tools they need to manage well. How do we actually utilize those tools to progress meaningful activities? So we build upon that foundation of knowledge, take it a little bit of a step further, and then engage in those activities that are important for people. So yeah, all of the referrals that come from me come from that one space. So they're sort of appropriate for the service. So there's some level of screening before that. In terms of sort of external referrals, again, every single person that I see, I individually assess. So because that gives me an idea of what I can do that's valuable for them, but also where they may benefit from, if there's any extra support that they need in sort of a mental health perspective, if there's any sort of other external referrals, whether it be sometimes drugs and alcohol, sometimes other support networks that may be out there. Sometimes it's actually just links to engage in their communities. So whether it's their local leisure centre, those kind of things as well, depending on what they're finding valuable. A lot of people are surprised by the sort of connections that we are able to sort of initiate. But yeah.
That's really helpful, thank you. And I kind of asked that just a bit because of the different areas geographically that I know we have people from in this group, and that long COVID service provision doesn't look the same throughout all NHS trusts or all areas. So it's just interesting to hear how that works, and that there might be people who don't have a long COVID service in their area, and what that looks like. It'd be interesting to, yeah.
Yeah, I have heard our service described as winning the postcode lottery, because we do have quite a very well-made service in Essex and Suffolk. So
Yeah, that's great. I love Charmaine's comment in the chat as well. So she says that she's a student in the long COVID community service at the moment, and she'll be leading a group on Thursday called Fatigue Management and Pain. So this webinar has really helped. So yeah, very positive feedback. Fantastic. Do we have any other questions?
Just got one more. There was one more from Liz. Sorry, Lisa, if you want to.
No, go for it. Yeah.
Which is what do you personally like about your job regarding physical activity and being an OT?
I think even before qualifying as OT, I always viewed physical activity as something that was way more holistic than just sort of getting fit or, improving physical performance. I think psychologically, and, research supports this extremely robustly, that it has such a positive effect on mood, anxiety management, those kind of things as well. So being able to help people who are facing quite significant barriers to physical activity still receive those very significant benefits that I've received personally, millions of people have received from just engagement in, activity and what that enables them to do. I think that's one of the most positive aspects of my sort of role here as well. And obviously just being able to see those outcomes and just being able to see the things that people engage in. Because yes, they can do a bit more physical activity, but what that translated into was I can now spend the weekend with my children and then not pay the price for it. So it's more than just physical activity. It's that psychological health, social health, but also just those meaningful occupations that become possible again after someone's engaged in a level of physical activity that improves their health.
Yeah, there's so many benefits to it. You're right, Jamie. I think often we, parcel physical activity offers maybe a leisure occupation, and actually it has so many more benefits. And yeah, no, that's great. Thank you for covering that. I'm just mindful of time, so if you do have any more questions, please do post them in the chat. But I did also want to just cover, for these sessions, obviously we've been playing around a bit with the day and time that we do them. We're also hoping over the next few of these sessions to produce kind of a resource for occupational therapists, OT students, OT practitioners, to be able to support physical activity in OT practice. And we're hoping that as part of this community of practice, we can co-produce that together. So it could be something that might look like, for example, a slide deck that people can take to an in-service and present on physical activity to their own teams or within their own job roles. And so that's something that's kind of coming in the pipeline. I just wanted to kind of make everybody aware that that's something that we're hoping to do in the future. And that's what some of these sessions might look like over the coming months. We will also have various speakers still coming probably later in the year, because we know that it's great to share all about physical activity and OT practice. And that's really valuable to hear about everybody's different practice. Fantastic. I don't know if we've got any more questions. I think we're good. So I'm going to let me just check if there's anything else. No, I think we're good. I will just stop the recording.